I am Dr. Mrinal. First of all, I think I welcome all of you to this meeting, international conference, and it's been pleasure to meet such a diverse delegates from across the nation. So I belong from India. So I'm a medical doctor by profession, and also I'm heading the oncology at MSN Labs, which is a pharmaceutical company based out of Hyderabad. And we have done this study on Pregabalin in terminal cancer patients who suffer from chronic neuropathic pain and depression. It was a series of observation studies. It was done in a research unit which was headed by Dr. Pinaki, who is the ex-professor in oncology at Gauhati Medical College Hospital in Gauhati, in India. So this was the research center where the study was conducted. So basically, 10 patients who suffer from chronic neuropathic pain, it was conducted. So we investigated pregabalin, which is actually a neuropathic, especially used in neuropathic pain. But we tried this drug in patients who have last stage cancer, and these patients also tend to have depression. So when we look at the articles and the research on this particular subject, if we see the depression, usually in advanced cases, it was found that it was as high as 49% in palliative care setting, and it was also found that, according to a paper which was published in 2015, that the progression of cancer is severely affected by the mood and mental well-being of the patient. So we try to understand how typical depression is different from that of depression in cancer. So there are particular attributes which are associated in depression in cancer. That is the fear of death of the patient, fear of pain, fear of chemotherapy, hair loss, weight loss, restriction. So there are other elements than the typical depression which a patient suffer. So needs to be treated differently with different drugs. So though pregabalin was not a typical antidepressant, so we try to look at different papers from different uh, publishers and different universities. So we come across this paper which was published in 2013, done into a 629 patient. What they found was the typical conventional antidepressant which we use to treat patients are not wise, and they are, because they are not helpful in improving the effect, or they have a very less effect in those patients who suffer from stage 4 cancer, terminally ill cancer patients. Another important attribute which we found was cancer pain has a poor quality of life, and more than 90% of patients have a lot of issues with the quality of life because of impending pain intensity, distress, and interference. So the critical unmet need which we have found in this specific group was to address the pain and also to address the depression in cancer patients. The rationale of our study was, though pregabalin is not a typical antidepressant, but it has some action like modulating the neurotransmitter, help in improving the sleep of the patient, and also help in chronic pain relief. So going into this, we actually hypothesized that maybe why not try pregabalin in this particular set of patients, and why not explore the idea of how it may work in these particular patients. So main objective was to evaluate the impact of pregabalin on pain intensity, depression, and also the safety profile in those patients who are suffering from neuropathic pain and depression. So it was an open label prospective observational case series which was conducted over a period of 8 weeks. Institutional Ethics Committee approved the study, and these were some of the inclusion criteria, like patient has to be diagnosed of terminal cancer, then they need to have chronic neuropathic pain, they should have depression, then they should be ambulatory, that is the performance status should be less than 2, and they should be able to give consent for the study. Some of the important exclusion criteria is not to use opioid for pain, and also patients who are very, very psychiatric patients who are under heavy antidepressants. So all those patients were excluded in the study. So these were the details of the 10 patients that are done in this prospective study. Though there were 6 females and 4 males, and patients 4 patients had lung cancer, 3 had breast cancer, 2 patients had prostate cancer, 1 had pancreatic cancer. So for a pain, though opioid was not used, but diclofenac was used, which is an NSAID, and it was used only for 7 days, just to see whether pregabalin will work or not. So we kept it in the study design that diclofenac need not be used beyond 7 days. And they were also into various other drugs like chemotherapy drugs like cisplatin and all other drugs which are given for different patients, different cancers. So how we have done the study? So pregabalin, the drug was given at a starting dose of 150 milligram 2 times a day, and it was given up to 300 milligram twice a day till patient responds to pain. They were assessed using different intensity scales at the baseline, then at 4 weeks and at 8 weeks. So for pain intensity, the brief pain inventory scale was used. For depression, Hamilton Depression Rating Scale was used, and side effects were self-monitored by the patients and reported. So what we see in this study, what we found was, compared to the baseline, that is day 0, by 4 weeks, it has shown good results in terms of controlling the pain. So 33% of the patients complained of less pain, and by 8 weeks, 47.4% patient complained of lowest pain. Though the sample size was very small, but the result seems to be very significant. 47% without an NSAID or without an opioid complaining of less pain intensity. Similarly, interestingly, we also found that depression was also reduced in those all 10 patients. And at the beginning, patient had moderate to severe depression, but by the end of 8 weeks, it reduced to 3.6, means it became mild depression. So it also had, the drug was also able to control the depression. Some of the adverse events which were reported with these drugs, but these are all reported adverse events like dizziness, drowsiness, weight gain, dry mouth. Those were the reported adverse event which was reported. So the conclusion of the finding is, if pregabalin was effectively able to reduce the pain and depression in terminal patients, and this finding supports the efficacy of pregabalin in this particular substance. However, as the sample size was only 10 patients, so we need further research in more number of patients to come to a better conclusion. So that's all from my side. If there are any questions, I'm